Hello, I'm Dr. Sheena G Soman. I work as a consultant psychiatrist in Mental Health Center at Trivandrum. We know our society, one of the most important problem, which is still very common, is suicidality and the risk of depression on the rise. In post-COVID era, we know that the mental health conditions, the mental health disorders are on the rise. Anxiety states, depressive disorders, and even the risk of suicidality is also on the high. So with this environment, it is highly important that we speak about the role of family in prevention of suicidality and how to identify and control depression and anxiety. We know in depressive states, the person can not only present with sad mood, lack of energy, lack of pleasure, but also with decreased sleep, impairment in their functioning, which can extend to social occupational fields also. And most of the time, near ones may not pick up the danger signs. One of the most important reason that there will be anxiety or distress from the family members is identifying depression or anxiety in their family members towards the late phase. Usually, it would be when a suicidal attempt or a suicidal act. One should know that suicidality in depression is preventable. Just like depression is a treatable condition, addressing it properly can actually reduce the suicidality. So what happens is that when a suicide act happens, the suicide survivors, the family members, keep wondering, what did they miss? How did they miss the signs and symptoms? So I just want to add a few words on what is the role of family in identification of depression at the correct time and how to support those with depressive states. So one of the most important features, I would say maybe in five headings or the 5S in the role of family. One is stability, second is safety, third is sharing, fourth is support, and fifth is supervision. So a stable family environment actually has a preventative role. Children, adolescents, when they go through a lot of emotional trauma or conflicts or unstable social environment, unstable family environment, that itself can predispose them to anxiety and depressive disorders later in life. We know history of abuse or traumatic experiences can make one prone for depression in later life. Early parental separation is one of the important risk factors for late onset or onset of depression in their adult age. So having a stable family environment, parental conflicts being addressed, and providing a safe environment at home, there starts our first prevention of depression. Then the children, adolescents should feel safe in their environment. They should know that they can always fall back onto their safety net. As adults, young adults, we should know what our safety net is or what our support system is. Whenever one falls, there should be a safety net of family and friends to hold them. Then comes the sharing part. If someone who is depressed or anxious, they may hide their feelings. They may hide their true mental status. They may find it difficult to share what they go through. So they should feel secure and safe enough to share with us. And once one person is willing to share their emotional pain with us, we should be ready to sit with them, hear them out. Most important is listening. And that is the most important aspect of communication that is required. You may not know how to deal with the distress of the person who sits in front of you and share your emotional pain. But listen to them, have a calm atmosphere. Don't be judgmental and understand what the person is going through. Try to understand what the person is in. You may have your own viewpoints or you may have your own experiences to share with them, but it's better to refrain from that and listen to what the person has to tell you. If you feel that you can really talk to them and address their anguish, go ahead. But if it is beyond you, and you feel that a trained third person, a professional help is required, do not refrain from keeping silent, but seek help. And that is the sharing part. Then comes the support part. Most of the time, young people, adults, they do not want to address that they have a mental health issue. They feel the stigma so much that they will sometimes run away from the support, from the treatment modes that we actually provide them. So we need to see that uh, they properly understand what our intentions are, that we are there to support them through their condition, that this condition is reversible and treatable. So support them throughout the treatment process. Sometimes it might be just emotional support. Maybe it is your physical presence. Maybe it might be, reducing their responsibilities, reducing the roles they play, the work related to the roles they play. Don't push them too much, but ensure that they are taking an adequate diet, they are able to exercise, and you are able to be a part of their activities. So that is one major aspect, that the family has a role in addressing depression and helping someone who is in need. Then comes the supervision. Then there is definitely features and signs of severity. When a person presents with significant severe symptoms that the impairment has set in, they are not functioning, they are not working, they are unable to study, they are unable to go to work. See that you should understand that that is where one should require help. Not only professional, but also the family has a role in the treatment process. One of the most important feature of severity is suicidal attempts or suicidal act. They may give you oblique hints that next Deepavali, I may not be there with you, or they might, write down a will, and they may do acts which has a finality in their intentions. So understand the oblique hints and final acts they might do with you. And you should, it sometimes such minor trivial things may be missed, and the family might wonder what happened when a suicide attempt happens. So to understand such oblique hints that the person gives to you, and catching them at that point is very important. So supervision is very important. The person has to take medicines regularly. It is always better to give the medicines with love and care, rather than giving the responsibility of taking medicines to the persons who are on treatment. It is always ideal that a loved one, a family member, caters to that and takes it upon themselves as the responsibility to monitor the medications regime. So I always tell my patients and the family members that not only the medicines that work, but the pills being given with love and care also helps. And these are the to-do list for the family members. Behave or interact with emotional warmth. It's better to avoid over involvement, keeping on, pushing them, but you can motivate them, be with them so that they have an adequate diet. They can be engaged in activities, and some exercise patterns can be incorporated in their daily schedule. And finally, one should avoid certain things also, like being very critical about them, feeling hostility towards them, criticizing them about the lack of productivity or the impairment they are showing. Be gentle on them when they're unable to get up from bed. Do not push and pull, but support. That is one of the most important aspects that a family member can give them. And sometimes once the depression settles, you may have to help them regain their skills. Some monitoring, some support would be required for these people to get back to their life which they had enjoyed before. But this should be for a period. Once the depression starts, we should know that it can last for even up to 1 year. So even if the person is on medications and is back to normal work, the supervised medical care and the supervision should continue for at least 1 year, and one should follow the instructions that the professional gives to you. One should continue the medications for the stipulated time that the medical or the psychiatrist advises you. One should continue the psychological interventions given by the team of psychiatrists, psychologists, or occupational therapists who might help you with dealing with depression. And that is the ideal way to control suicidality. And I repeat, suicide is preventable. Most of the time, behind a suicide, there might be an undetected medical condition, there might be an undetected mental health condition, and helping them through it will in turn reduce suicidality. So let's live our life, let's support those in need and be there for them. Thank you.